Hi there, I'm Mabel Chan, and this is One in a Billion, part 4 of our special series, True Colors. True Colors is about the color of our character, not our skin, in times of crisis. How we respond reveals who we are and what we care about.
I mean, this dangerous shortfall in protective equipment for American health workers was the news in March. It was still the news in April. And it's still the news tonight.
That's Rachel Maddow of NBC News. Back in May, as the pandemic was infecting thousands of people every day, sending many to the ER or the ICU, doctors and nurses were overwhelmed. There weren't enough N95 masks, surgical masks, protective gowns, hand sanitizers, and so on at the hospital. As a result, more than 62,000 doctors, nurses, and other frontline healthcare workers got infected. Almost 300 have died, according to the CDC, Centers for Disease Control and Prevention reports in May.
I am an emergency doctor. I was in Elmhurst, which people have been calling the epicenter of the pandemic. It was really intense. The cases of COVID started ramping up, especially the really sick patients. We take care of the sickest patients in the hospital.
That's Dr. Alicia Lu, based in New York City.
I was very concerned about our level of exposure, especially during high-risk times.
I remember fear that I had of my partner being on the front lines. I felt torn. I was concerned. We're both concerned about, her safety and if that sort of contamination could spread to others.
That is Dan Wu, Dr. Lu's partner. Together, they turned their concern into a campaign. It's called 1,000 Frontline Suits, all washable coverall. In this episode of True Colors, we're talking about protecting frontline doctors and nurses. Here's our conversation. I'd like to begin the interview by asking you, Dr. Lu, to describe the scenario you've written in your op-ed for CNN and pinpoint the moment that you realize when you're putting yourself and your team in danger.
As my patient lost his pulse, not one person hesitated to take action. A nurse jumped in to do CPR. A physician placed a breathing tube in his trachea, while another placed a large IV catheter for rapid blood transfusion. As an emergency physician, I was the team leader, assigning roles and directing every action. My team had done this hundreds of times. However, as the chest compressions spewed secretions into the air and blood and feces soaked the bed sheets and our garments, I was aware that this resuscitation was different than the rest. This was the first cardiac arrest where we, the providers, were significantly at risk of contracting the same disease that led to his deterioration.
Wow. And then what did you decide to do right then?
We kept going. We did what we have been called to do. There was one person that came in and accidentally forgot his face shield. So in the middle of it, I had just quickly reminded him to step out and grab his protection. But everybody else was wearing the standard protective wear. We kept going until he got his pulse.
Did he survive?
Unfortunately, no. He was still in very critical condition throughout that night. He passed away the next day. During this time and every day, I would tell Dan that I was still very concerned about our level of exposure, especially during high-risk times. I kept telling him about the problems we were facing. In our discussion, we both came up with the idea of a washable coverall. Really, the idea originally came from multiple countries in Asia, in Europe, of other healthcare workers who were wearing essentially hazmat suits, or what we commonly call Tyvek suits. And around that time, Atul Gawande, he's a prominent physician writer, he came out with an article in the New Yorker about lessons we can learn from Singapore and Hong Kong, which we really admire his work. And one of the first things he pointed out was this full head-to-toe protection. But one thing he mentioned was that American hospitals and American supply is just limited, and we wouldn't be able to provide every single healthcare worker with a disposable coverall or a Tyvek suit. And to me and Dan, as we talked about this, we realized, well, what if we could try to do the next best thing by providing washable coverall suits that at the very least just add another layer to our clothing. Both Dan and I thought, what if we could just provide people with washable suits to supplement some level of head to toe protection underneath our standard protective wear that we're given, including a gown over it. That way, it's washable. So each healthcare worker, even if I had one, it would allow me to reuse that one without wasting another suit every single day.
Right.
I jumped on this opportunity to try to help in whatever way I could. The fact that we had come across these articles pointing to some beam of hope, that in East Asian countries where they were wearing head-to-toe suits, and there was some evidence that this could drastically reduce infection rates for frontline healthcare workers. We just kept thinking, how can we make this possible here? What can we do? And it all started from just both of us and Googling for possibilities of things that we could purchase really easily. We wanted to start by just purchasing some suits that we found on Home Depot, and send that over for her and her coworkers.
So Alicia, tell me about how you start asking people about these washable suits. Did you go around with a picture and say, hey, would you like one?
Soon after that case that I told you about with the cardiac arrest, the medical ICU got a small donation of Tyvek suits. One of the nurses shared one with me. And I asked, where did you get that? And she said it was donated to us. And she gave one to me. So as I went down to the ER, when nobody, not a single person was wearing any sort of bunny suit or Tyvek suit at the time, I got a lot of comments and a lot of attention, partially because it looks so silly, but also because I could tell people wanted it. And they started asking me, where did you get one?
You were a model right away.
Yeah. Immediately, this reinforced what we had thought of. This is something people want, not just myself, but my colleagues. They want to have head-to-toe coverage. Later, they came out with a study simulating an intubation, which is putting the breathing tube, and the person doing the procedure, usually an emergency physician, anesthesiologist, or a critical care physician, that person was found to have fluorescent markers that simulated secretions all over their neck and their ear.
Oh, wow.
Even while they were wearing the full PPE that we were given. So we wanted to be more covered, and that COVID is transmitted by respiratory, but also by contact. And the virus can live up to 3 days on a surface. So this was concerning to us because we have our arms exposed, our neck is exposed. I started just asking people, what do you think about this idea?
Alicia was definitely very much like a community organizer there. More and more attendings, people that she admired and worked under, started saying, I would feel so much better if I was like in an astronaut suit. Or like, why don't we have those suits that you see on the news when you look at like healthcare workers in Korea or Taiwan? Why isn't that here? And she just, this sudden understanding that there was this unmet need and this desire to fill it. And so out of all of these like basically informal conversations, we then decided to create a request form to kind of gauge the amount of interest. And then very quickly we got hundreds and hundreds of requests asking for suits like this. I really have to applaud the way that Alicia, she's a fantastic relationship builder, brought up conversations informally with senior physicians and her coworkers and nurses and techs around like their thoughts about their experience with COVID-19 and bringing up these possibilities and ultimately garnering more support and interest around it.
Right.
This disposable Tyvek suit, they definitely did not last. Within 2 days, nobody was wearing them anymore.
So what did they do? What did they have?
They were back to their regular scrubs. CDC recommended PPE, which was the disposable gown and the N95 mask and face shield. But a lot of people think the gown is the same thing as the coverall suit. It's not. The gown only covers the front of your body, your arms, your torso, but it doesn't cover your neck. It doesn't cover your entire back or the bottom of your legs, whereas a coverall covers you from head to toe except for that small part of your face.
Which will be covered by your mask.
Exactly, and the face shield.
Right, right. So Dan, walk me through step by step. Once you realize there's interest, and then what are some of the other steps in terms of fundraising, team building, manufacturing, prototype, or did you just wholesale order and distribute?
One thing that we realized was that we had to be very practical around how we were going to donate this, because this isn't, as already discussed, a reusable coverall isn't the standard protocol necessarily, and so hospitals may not know what to do with it. So we wanted to identify interest from the bottom up. And so that's where our request form and gathering individual relationships as well as champions in other hospitals that we wanted to work with.
Right. Name some that you've gotten the support from.
Like one example would be Lincoln Hospital and Downstate. Lincoln is in the Bronx, if I'm not mistaken, and Downstate is in Brooklyn. And so these are other hospitals that are serving some of the most vulnerable New Yorkers. And we worked with awesome champions there that Alicia basically sourced through her network to find partners through which we could distribute the suits. After that, after realizing and identifying a lot of that demand, we simultaneously started thinking, we can't fund this ourselves by any means. And so we started asking our friends in our community to see if they would be interested in helping us get these suits out to people. So Alicia and I worked on a crowdfunding campaign on GoFundMe, and we just shared her story about everything that you had already heard. And the response was dramatic. Within a day, we had met our fundraising goal of $50,000.
Right. Now, Dan, you and I belong to the Harvard Asian American Alumni Network. Was Alumni Network part of the circles for you and Alicia?
Not for the initial fundraiser. We had a second round after we had distributed our first 1,000 suits. For that second round, H4A was fantastic. The H4A is the acronym for the Harvard Asian Alumni Association, and it actually had helped organize a COVID-19 response discussion roundtable that had dozens and dozens of H4A alumni attend, and I hosted a breakout focused on how we could help our healthcare workers. And of course, I discussed Frontline Suits and some other really interesting initiatives, and members there were kind enough to donate and reshare the opportunity as well. So H4A definitely played a role.
Right. Well, Alicia, I want to focus on you and how you prepare each day. How do you go through each morning to prepare yourself physically, mentally, emotionally?
Before we had launched the Frontline Suits campaign, before I was wearing the washable coveralls, each morning I would get my things from home to go to the hospital, a single bag that I have that carries all of my personal protective equipment. By the time I get to the hospital, we usually have a team room where we are able to then get ready. And so my first step would be to put on my N95, tie back my hair, we have a scrub cap that covers our hair. I have eye protection, so I wear goggles. And on top of that, I wear a helmet, which sounds very intense, but now it's become very normal. The most important part is taking off the PPE because you don't want to keep the contamination and bring it with you to other areas of the department.
Right.
I would remove all the PPE before exiting the patient room, and then I would just be wearing my scrubs. And then by the time I got home, I just immediately took off my scrubs and went to shower.
Well, that definitely helps reduce your level of anxiety about yourself being so contaminated, and yet you have to focus, right, on doing your job, saving lives, and centering yourself. Dan, I want to ask you, walk me through the campaign. How many volunteers were you able to build around you, and how much did you raise, and how did you distribute the suits?
So we raised almost 100K in total when we realized that more and more people wanted this past the initial 1,000, that we needed to find new sources of supply. Of course, by seeing if people still wanted to donate, there was still interest in helping us get more of these suits out. In terms of volunteers, we didn't have any dedicated volunteers, just more ad hoc, an informal group of 15 to 20 different friends in our network who we consistently ask for advice.
So operationally, if you can summarize, once you have raised 100,000 to buy how many suits and how many volunteers do you have running around driving them to the hospitals? And that is the nitty-gritty I'm curious about.
You're hitting on something that's been a really, really difficult part of this process.
And in terms of distributing, so one person at each of the hospitals that we've donated to, the major ones were Kings County, Lincoln, Jacoby, and Elmhurst. And I was the point person at Elmhurst, but at each of these other hospitals, we identify one person, usually a resident physician in emergency medicine, someone in my network, who volunteered their time to receive the donations, get a list of people who requested them, and distribute them out to those people. I would say the bulk of the suits that went to Elmhurst, I was just basically every time I went to work, I would carry a huge bag with me, and people would ask me what was in my bag. And they would have suits with people's names labeled on them with the correct sizes. And I would just find those people, and they would come ask me about it. After we started getting such positive feedback, and I also work at other hospitals, Mount Sinai, Beth Israel. So I remember going to Mount Sinai, and more people were asking, they were seeing the suit I was wearing, and they were asking me. And so then we started donating to Mount Sinai, NYU, Bellevue, and it just expanded.
For the first week of April and the later parts of March, we're really focused on purchasing the suits and distributing the initial 1,000.
Where did you find these suits? Were they made in Taiwan?
We were really wary of purchasing things overseas, so we made an explicit decision to purchase everything domestically. So we found analogous items that were reusable from other industries that were facing things like chemicals and contact. For instance, automobile workers and painters were some of the industries that we had found that were easily accessible, that were within our budget. We realized very quickly towards the later part of April that we were reaching a breaking point. We were quickly running out of supplies. We would have to create our own source of supply.
So is that when you decided that you got to write an op-ed in CNN to draw attention to what you're doing and to get more help, to get reinforcement?
The motivation for publishing the op-ed actually started when the project started. Our hope was that this could be a project that goes beyond donating individual items to people and actually serves as a way to advocate for potentially policy changes. And we've been working on this ever since, and I'm still writing more. And Dan and I are working on projects to try to scale up this idea. We were very clear to every single person we donated to that this item is not PPE. It's not defined that way at this moment, which is why we're advocating for the policy changes so that it could be included in our standard PPE. We did not want people to think that this was 100% protective from all contaminants and going to relieve. We just didn't want to mislead anybody.
Right. How did you get hospitals to agree to take this on even though it's not medically proven?
So that's why in the request form we made it extremely clear that they need to wear a gown over it, that it's not medical grade. And so that way every single person who filled it out and received the suit understood it. And I think that was pretty key to our project in terms of getting hospitals to be on board or not. Ultimately, we donated this to individuals.
It's free.
Exactly. There were so many people wearing them and so many people who really appreciated them, and they were wearing them appropriately. Our administration became very supportive.
So Dan, is this campaign ongoing indefinitely? What is your plan? And so far, have you been able to make any profit from this?
No profit. We're completely using all of the donated money to just purchase all the items and then donate them without cost.
Our goal is to change policies to recommend something like a washable coverall in addition to the current PPE guidelines.
Well, listening to you, Dr. Lu, I just feel that we're all fighting this horrible virus together, right? And for you, as a healthcare ER doctor in ICU, that's even more urgent to protect yourself. And then we as Asians in America as well now have become the face of the virus because many people have gone mad over this, calling this a China virus and attacking Asian people physically and verbally.
Yeah, and Dan and I have talked about this. We've both experienced different forms of attacks or bias against Asians during this time. I feel fortunate that I haven't personally been attacked, but when we read about other people who are attacked based on their race, it also makes us nervous. In the very beginning, Dan and I were nervous to wear masks even on the subway, even when I knew that that was a good idea. I was concerned about my family members, and Dan was as well. I think it's a reflection of a larger aspect of our culture that we really need to better understand how we can improve our perceptions of each other and how we deal with questions of race, because it's not only harming the Asian community, but our friends who are Black and brown and other people of color are suffering from multiple types of hate crimes as well.
After we published the CNN op-ed, there was a message that someone had sent telling us to basically go back to China, and that we sounded like very self-entitled. We were definitely taken aback, but that was probably the most direct, in-your-face experience that I had with this type of racial abuse during this time period. And I think a huge part of it was that we were willing to put ourselves out there.
My gut reaction to this is that there is just a lot of anger. The issue really is anger management, and that came out as hate. I'm just going to ask you this question, Dan. What are some of the fears circulating in your head that you can share with Alicia as you're going through this together, meaning the COVID-19 virus and the environments that we live in? And what you can't share with her that you want to talk about now?
That's a great question. Just seeing what happened with COVID-19 and thinking about, wow, what if there was the next pandemic or the next crisis that is even worse than this one? Will we be able to handle it? And what would happen if Alicia was older, had more obligations, potentially was physically weaker? What are my obligations to urge her in terms of her participation as a frontline worker? And I felt a ton of conflict around that.
As you're looking ahead, what are some of the lessons looking back so far that this global pandemic has taught you? How are you changed, Dan?
I would say the biggest way that I've changed is being willing to ask for help. I was just so taken aback by the upswelling of community support when we had asked for help in trying to find resources for Alicia and her colleagues. I did not think that we would raise 50 plus K in that day. And that really made me more hopeful about people from lots of different backgrounds coming together. We've been talking about the discrimination against Asian Americans, At the same time, the COVID-19 response shows the upswelling of support from people with lots of different backgrounds across race and gender and class coming together to think about ways we can support each other. There's a lot that we can learn about people's uplifting those who are at the front lines and helping them be part of the solution.
How were you changed by this whole experience of being an ER doctor at the front line over the months that you had to confront life or death?
I'm a pretty new doctor. I've done this for 2 years now, and before that, I was in medical school, and so yeah, it's been a really steep learning curve. One of the most important ways that I stay motivated at work to do my best is by holding on to the small or big success stories. You know, I'm reminded of the first patient that we took off the breathing machine so that he could wake up and breathe on his own. And that was really impactful. It was during a time when we had already had weeks of just seeing people crash and do terribly and unfortunately die. And I had personally pronounced many people dead and had to tell their family members. But this one patient that was my first patient we were able to take off the breathing machine, it was just truly memorable and also uplifting. Actually, he speaks Chinese. I had the benefit of being able to communicate with him, and I was just overjoyed that he was awake and talking to me.
Thank you, Dr. Alicia Lu. Thank you, Dan Wu. In our next episode of True Colors,
the ability for people like my family and for basically all the Asian American families who immigrated here after the 1960s or the 1970s, we literally owe our existence on this land to Black Americans.
That is Eileen Wong, a junior at Yale University and a creative writer. We owe them everything. That is our next episode in 2 weeks. 1 in a Billion is
Brian Latwinowicz,
Yvette Yu,
Maggie Shi,
Leah Yen Jarrett.
And our lovely theme song is composed by Brad McCarthy. Let us know if you want to join our team of volunteers, help us plan events, pitch a story. Just go to our website, oneinaBillionVoices.org, and find us on Facebook, Twitter, and Instagram.